Well, welcome back to another edition of On Location at GPRMC. Today we're visiting the lab and we're going to see how they process 600,000 tests a year and help doctors make diagnoses that ultimately help the patient. So we're going to go try to find Bill Marsh, the lab director, and he's going to give us a detailed tour of the lab and see how it runs from day to day. And there he is,
Yeah.
Mr. Marsh. How you doing?
Good morning.
Good.
Good to see you.
Good to see you. So we're gonna see how the lab runs today and see how you guys process 600,000 tests a year and how this thing works. So do you want to tell us a little bit about the lab?
I can tell you a little bit about it. We do work for hospital inpatients. We also have hospital outpatients that come in from their physician's offices to get things done. You know, we want to produce the highest quality in the shortest amount of time, particularly to patients that present to the emergency department.
Okay, this is the hematology department, and this is where we look at blood cells and do blood counts. One of the most popular lab tests that we do is a CBC, which is a complete blood count. This is the instrument that we do that on. This is called the Advia 2120. It's one of our more sophisticated instruments that we use. So you're going to barcode this, then you'll turn it upside down, push it down into this hole.
Okay.
A needle will come up through the bottom, through the cap, and aspirate part of the specimen, okay?
Now, hematology, that's the study of blood, is that
The study of blood cells,
All
correct.
right. So how long will it take to run that test?
Oh, about a minute.
Oh, that's easy.
Yeah, there's our results right there.
Oh, wow.
Okay, then when it's done analyzing this results, they're sent across over here to our computer system. We look at it, it's the exact same thing that's on the printout, so you want to make sure that that all looks normal. And now all that data goes across to Eclipsis and is available to the physician, just like that.
So it'll be up on the floors,
Right.
and that's really neat.
It's there now.
It's
They
there
can-
now. So
yep.
that took us, what, 2 minutes to do
2
that?
minutes,
Wow.
not quite even that long. I've worked in every department in here.
What do you like the best?
Well, right now, hematology.
That's good. How come?
Because I'm the boss, I guess. I don't know.
So we're in the histology lab now with Nancy, and histology is what, study of tissue? Is that right?
Yes, and their diseases.
Okay.
So
So what are we gonna do today?
We're going to look at some tissue specimens that come from surgery, even though we do get tissue specimens from outside the hospital. So if you would like to take a label off of here,
Okay.
this is our next number that's in line, and you need to put it on this requisition and also on the second sheet. And then I'm going to have you open this up and we'll put it on here as well.
Okay.
So
Anywhere?
go ahead, anywhere. All right, so this is ready to go into the gross room for the
Okay.
pathologist. So we'll take this in here.
Well, we're with Elena, and we're up on the 3rd floor. And Elena's a phlebotomist at Great Plains, which means what? Collecting blood? Is that
Yep,
right?
drawing blood samples
Drawing
and
blood.
taking them back to the laboratory to be processed.
And so now we're going to go up and get some blood from a patient. Is that the plan?
Yep,
All right.
we're
Well,
going
let's
to
do
be
it.
drawing a troponin this morning, so those are our forms of
Morning, Carol.
verification.
I'm Greg from administration. I won't be drawing your blood this morning.
He's going to be observing this morning. All righty,
Less pain is always better.
that's
That's right.
right. There you go. Thank you, Carol, very much.
It's a handy cart.
It is.
Do you have a place for snacks or not?
No snacks.
Okay. Well, this is Ruth, and we're headed into microbiology.
Yes, that's correct.
What does that mean?
Microbiology is the world of bugs, where we identify organisms that are causing patient infections. So I thought what we would do today is show you how to do a urine culture from start to finish. Just happen to have a urine
All right.
sample for you.
Okay.
Okay, perfect. Now pick up your blood auger plate, go right down the center. There you go. And now go streak through. Very good.
That's it?
All right. So we're going to take this culture plates right over here into this incubator. And we will put it into this rack here, where it will remain overnight. And you see you have colonies. These little dots are called colonies. And there are millions of bacteria in one individual little colony. So what I thought we would do today is do a little smear of this, or a gram stain, to show you what that looks like under the microscope.
I'm seeing purple.
Okay, you're seeing purple and they're little dots.
I'm
right?
thinking that's gram-positive.
Gram-positive cocci.
That was my
Specifically.
next guess.
Yes. That is what staph looks like.
Chemistry. So
Yeah.
what are we doing in chemistry?
Basically running comprehensive panels and drug screens and therapeutic drugs. So we take this little rack here, we leave the barcode out. Again, everything's ran by barcode, positive ID on the patient, and we'll put it onto the instrument over here.
All right.
We hit the run button here, and the instrument's going to take it across. Now the nice thing with this instrument here is it's a combined platform. It's actually two instruments that are married together by what we call a closed tube aliquotter.
Did you say flux capacitor? Or-
It's pretty close.
Okay.
So, and this is primarily the workhorse. This is where we're going to be doing our comprehensive panels. This is where we're going to be doing our therapeutic drugs. We can also do drug screens or drugs of abuse testing.
So this thing does the same as that.
Exactly.
So that's another 450 gram?
Yeah.
Who authorized that?
Someone higher up than Bill.
Well, that's a wrap for today's edition at On Location at GPRMC. We've greatly enjoyed our visit to the lab and all the departments, and we've very much seen what's behind us today and this teamwork, commitment to our mission at GPRMC and also each other. Again, with the 6 different departments and 39 employees in the lab, they function together as a team, really ultimately for the benefit of the patient, getting the results back up on the floors or into the patient's or physician's hands, and they play a vital role here at GPRMC. So again, we thank you for tuning in today, and join us next time when we're in same-day services. Thank you and enjoy.